Hey, good morning, and welcome to the UroPatient podcast. I'm your host, Vic Sinise, and welcome to the show. Hey, we come to you live every Saturday at 10:30 a.m. on YouTube and on Facebook. So welcome to the show if you're watching us live. Otherwise, we're always available on demand. Check out our website to learn more about our show at UroPatient.com. Also, best place to get our downloads. You can go over there and download any of our handouts. And hey, we're going to have a great show for you today. We're going to be talking about circumcision. Should you even have your pencil sharpened? Very debatable subject. So we're going to talk more about that right now. Let's bring in our slides here. So it's a practice that dates back thousands of years and deeply rooted in cultural and religious traditions. And so those that are in favor of circumcision, raise your hands. Well, there's our group of people that we're talking about right now are the neonatals. And the reason that circumcision got to be popular is performed early on as a newborn. Circumcision can prevent phimosis and paraphimosis. Now, these are problems that occur later in life. Generally, talk a little bit about those. But one of the things that really drove a lot of people to having this done is the markedly decreased incidence of cancer of the penis in U.S. males. Now, it's been found also, some of the folks will argue against it, say that, that with proper hygiene, cleaning the foreskin, etc., that those levels are pretty much the same. But there's no question about it. There was a decrease in the, in penile cancer, which is fairly rare, but it's almost eliminated by circumcision, which is why it became so popular. Also, HIV had some effect on it. Now, in Africa, it had no effect on venereal diseases like syphilis and gonorrhea, but they saw a 50 to 60% decrease in the risk of passing HIV to an HIV negative man from a HIV positive woman. So that also led to some popularity. So phimosis and paraphimosis, I mentioned earlier, what are they? So if you never had a circumcision, down the line, it's possible you could get a narrowing of the foreskin called phimosis. And that's what leads to most of our adult circumcisions. It's usually from some kind of infection that sets up under the foreskin. Paraphimosis is a little different problem. That's where the foreskin gets pulled back behind the head of the penis and somebody is not with it enough to replace it themselves. And so typically scenario, a nurse or doctor comes in to put a catheter in, pulls back the foreskin, forgets to return it, and then the penis will swell up. That could lead to a circumcision in an adult, or certainly an uncomfortable procedure to reverse that. So who does circumcisions? Well, in the U.S. anyway, most of the circumcisions are done by your OB-GYN. They do by far the vast amount. I was lucky enough to work with a pediatric urologist in our group, so we did a number of those in our office. Typically, the patients we saw, for some reason, didn't have it done in the hospital, or they didn't, decide they wanted it done, so they came to a pediatric urologist to have it done. But either way, they're all qualified to do circumcision. The proper equipment that we use for circumcision is pretty simple, and it is an in-office procedure. We need a restraining board to hold the baby down. This is actually the part that most infants don't like the most, but we've got some tricks, and I'll talk about those. And then we use these special devices for doing circumcisions, these special clamps that protect the foreskin from the head of the penis when you're cutting it, this little bell device that you see there, and also seals the edges, so there's no need for sutures. I'll show a little bit of video on that. And then a pacifier, believe it or not, one of the most essential parts of doing the procedure. Now, of course, even the cowboys got a stick to bite down on before they cut their legs off. Just kidding. But no, there's really good research out there that shows that the use of a pacifier releases something called endorphins. These are like a natural brain chemistry that causes pain relief. So we get the patient, as soon as they're laying down on that board, get a pacifier into their mouth, let them start chewing away on that. And it often will help to calm them down and relax them. A lot of times they fall asleep. There's another product that we use called Sweeties. It's a very sweet solution that you can put on, safe for infants. We dip the pacifier in that, and they go to town on that because it tastes so good. So, and again, it releases some of these endorphins to help to relax the little baby. Now, this is recent or more recent research that came out, and the fact that lullabies actually release those same endorphins. So, we always play lullabies while we're doing it, and it also seems to have a nice calming effect on the baby. So, really, it's not a traumatic event. Should not be a traumatic event like it used to be in the old days. And finally, we use anesthesia. We give a local anesthetic. It's an injection with a very fine needle given at the base of the penis that numbs the entire penis down. So the little baby doesn't really feel anything. Old days, years ago, they did this without any anesthesia, and they felt that babies either didn't feel pain, or some people thought, well, it might toughen guys up if they experience pain young. Um, Studies have shown that that's not the case. Babies do feel pain. You should use an anesthetic. And actually, it's adverse to try to do something that could cause pain to an infant because they can often develop some kind of memory or imprinting of that pain receptors, making it worse down the line. They're more sensitive to pains. Good studies out there that show that. And this is how it works. You put this little bell device inside of the foreskin, like you see here, and then it's attached to this other mechanism that you see over here, like that. And the foreskin is kind of pulled through around the bell. So all the cutting that takes place is got that bell protecting the tip of the penis. So it's really it's impossible to injure a penis with this device as long as you properly place it. And you can see this little turning knob is what tightens down the clamp, and that is basically to press those edges together where once you make the cut, there'll be no bleeding, there's no need for sutures, and it's just a quick snip snip and that little piece of foreskin is removed. And just like that, the device can be removed. There we have sharpened pencil. Now, there are things that can go wrong with a circumcision. I'm not going to lie to you and say it's a perfectly safe procedure. It does have risk. Bleeding can occur if not the clamp doesn't work properly or some bleeding problems, infections, penile injuries, some things called buried penis, meatal stenosis, skin bridges, cordae, and just poor cosmetic look. So these are rare things, but just so you're aware. Now, the biggest issue that people complain about or people mention is that these patients are not really given a informed consent because they're too young to give an informed consent. So there are some patients out there or people that have had foreskin removal that complain that they think it's caused problems with their sensation as an adult. And actually, there are some procedures out there that are being done to try to restore foreskins for these patients with some tissue stretching or actually surgery to create a new foreskin. So the debate is the whether this should be done on somebody who's unable to give consent. Although, as we mentioned, most of these are done for cultural and religious reasons. Um, you make the decision. Adult circumcision is a little different story. Those are almost always done because there's an issue on somebody who didn't have a circumcision. These are the folks who wish they had it done. So as I mentioned earlier, this thing called phimosis, as you can see on the left, that's the foreskin is narrowed down and the man can't retract it back. And sometimes it can get to the point where it's actually obstructing the flow of urine. So then a proper circumcision needs to be done to remove that skin and things that cause that are typically like diabetics who have sugar in the urine. The urine is sugary and it sits in the foreskin and leads to infections over and over and can cause scarring. So this is a video of how we do the adult circumcision. Um, Again, that's done in the office under local anesthesia. It can be done in an outpatient center, but it's a pretty minor procedure for us. I always say the definition of a minor procedure is something you do to somebody else. But as you can see, this kind of marks where the incisions are made. And it's really just a matter of the same thing. We numb down the base of the penis with lidocaine solution. By the way, this is a model of a rubber model. That's why you'll see no blood, but it's a model that we use to train on. So you can see here, we're exposing the head of the penis by cutting back the foreskin. We'll just complete those cuts around the edge, and then it's a simple matter of suturing that edge together. Unlike the newborn, who we use that special clamping device that kind of seals those edges, in the adult, we have to actually physically go in there and stitch them. So you'll see we'll put stitches all the way around and tie that those edges together. We use a self-dissolving suture, so you don't have to come in to have those removed. They'll just fall out over the course of a week to 10 days. And then everything will be back to normal. Voila. A little dressing, and this little guy is ready to go. Again, there are side effects, very same side effects that we saw with the infants. They're the same issues that can happen: bleeding, infection, pain, discomfort, swelling, bruising, delayed healing, scarring. One of the things that doesn't occur in the neonatal that we do see some complaints with the adults is because the penis has not been, has been covered its whole entire life, and the head of the penis hasn't been exposed to things like underpants and etc. that kind of rub up against it. There can be complaints that the actually the sensation in the penis can not go down, but actually be more sensitive and almost irritating. So, and it can be sensitivity to the pressure, like I said, of the underwear. Some guys complain it feels cold. One guy was complaining so much that his penis was bothering him that now that it was exposed, that his wife made him a little knit hoodie to put over the head of the penis to help him. So the bottom line is circumcision is a safe, simple procedure. Doesn't take long to do. The side effects are pretty minimal. Pain level post-op is very low. So again, it's a decision that you need to make with the input from your physician. Decide what you want to do, whether you think it's a good idea to have done as a baby or not. It's kind of that's pendulum swings back and forth as to which is the best way to go. I always say most baby boomers, like my age, have been circumcised because of the penile cancer risk. People were getting on board. Then as we started seeing it wasn't such a big deal, more millennials don't get circumcised. So it kind of goes back and forth. Who knows what it'll be in the next decade. But anyway, that's our program for today. Hope it was informative. Next week, we're going to talk about bladder cancer, what you need to know, because what you don't know might be killing you. We'll see everybody next week on UroPatient.